Propofol and EMS. Let's talk about it. Happy Monday. And if it's the first time we're meeting, hi, I'm Stacy. I'm a paramedic instructor. And today is Medication Monday, which means that we're going to go over a different medication that we may run into out in the EMS field. Propofol isn't something that we typically run into, but it's definitely going with the theme this week. If you haven't already checked out my celebrity deaths and EMS perspective, I went over the high-profile case of Natasha Richardson last week, and this week we're going over the high-profile case of Michael Jackson. So it seemed only fitting that we dive into Propofol, so let's get into it. First things first, Propofol is the generic name, and if we run into a brand name, it might be Diprivan. The drug class it falls under is sedatives and anesthetics. So why in the world would we use Propofol or see it used out in the EMS field? Well, we may be using it or seeing it used for sedation maintenance in mechanically ventilated patients. Propofol works by acting on the GABA receptors, and this induces central nervous system depression, and that is what causes the sedative and the hypnotic effects. And the contraindications of this medication are going to be hypovolemia and any allergy or sensitivity to soybean oil, peanuts, or eggs. I always like to put the disclaimer out there that even though this is an informational video, you have to abide by your local protocol and stay within your scope of practice. Propofol isn't something that you typically see on the ambulance, so if you do see it, it's going to most likely be during some type of EMS transport, meaning that the physician has already determined some type of maintenance dose for you to administer and given you instructions on it. So we don't typically get a dose on Propofol. It's determined by the ER physician or whatever physician is in charge of the patient care prior to our arrival. As for adverse reactions that we could run into, obviously central nervous system depression is expected with this medication, but we have to monitor it to make sure it doesn't get too severe. Hypotension, nausea and vomiting, and even some dysrhythmias. As for drug interactions, since Propofol is a central nervous system depressant or a downer, if it is given with any other downer such as benzodiazepines, narcotics, other sedatives, etc., then the effects of the medication can be potentiated. So just keep a lookout for that. And a couple of side notes about Propofol. It is referred to as the milk of amnesia, which is just a play on words instead of saying the milk of magnesia, which is something completely different but has that same milky white look that Propofol has. So you may hear it referred to as the milk of amnesia or milk in general. And it is also said to be the main contributing factor in the death of Michael Jackson.